Hello, everyone, and welcome to another live Q&A session with Toronto's Associate Medical Officer of Health. Dr. Vinita Dubey joins us again this week. Welcome, Doctor.
Thank you.
So once again, we have been collecting your questions all week, and I will be moderating this chat today. My name is Dilshad Burman, and I'm a web writer with CityNews and 680 News. All of your questions that have come in over the week, we're going to try to get to all of them. If you didn't have a chance to submit your questions, you can do so under the live broadcast right now. And again, we'll try to get to as many as we can today. So let's get started with the list that we already have. Doctor, you ready?
Yeah, let's go.
All righty. So let's start with a couple of mask questions this week. Matthew asks, can you get sick from wearing a mask?
Not really, no. I mean, the mask is there to protect you. I think the one caution that I would say is if you wear a mask that's dirty or you wear someone else's masks, you could get their germs onto your face. So that would be one example of how you could get sick, but that's not how we recommend that we use masks anyways.
Absolutely. And you wash them every time you use them and all of the regular precautions.
That's right, yeah.
And then Lori asks, where do you dispose your masks safely because there are no biohazard bins anywhere?
So disposable masks can actually be thrown out in the regular waste in a lined bag. So if someone has COVID in their house, the recommendation is that their dirty tissues, any dirty masks be just in a lined garbage bag and be put in with regular garbage. And the reason for that is that we know that after a few days, any virus that may be present on some of that garbage will actually not be able to infect anyone. And so that's part of the reason why regular garbage is okay here.
Okay. And then we've got a couple of travel questions. Tiana asks, don't you think they should close access from traveling between provinces as the long weekend is coming up and people might travel, so it's probably better to close off the borders between provinces?
It's a good question. Right now, there's actually no mechanism in place when you actually cross the provincial border to check you don't show your Ontario passport when you go into Manitoba, for example. So I think that's part of why it would be difficult to do from a logistical perspective. I think the more important thing is that if you travel, you have to recognize what your risks are for where you're going. It's also when you travel, you're on vacation, you're more likely to go out for a meal. The people that you're visiting with, you want to spend more time with them. You may not physically distance. And I think those are all the reasons why travel may be more important to spread the virus. We are certainly recommending that you try and stay to your house or within your house close by as much as you can this Thanksgiving.
Okay. And then Mike Johnston asks, why are flights still being allowed into Canada from other countries? I know that's more of a federal thing, but perhaps you can share your thoughts.
Yeah, so I mean, Canadians can always still return to Canada, and that's why you're seeing that flights are still allowed. There are some repatriations still occurring. There are Canadians who have essential jobs who are traveling and so are flying for those reasons as well. I think the important thing, though, is that whoever travels, when they come from another country, they need to keep that 14-day quarantine, and there are clear guidelines for that.
Yeah, so speaking of the 14-day quarantine, this is something that came up a couple of weeks ago, and recently we've seen a few news stories about this as well. So when you're in the 14-day quarantine and you get a COVID test, and that test comes out negative, do you need to continue on with your full 14-day quarantine, or once you're negative, you can just run about?
You need to continue those full 14 days. And part of that is we actually don't recommend that you routinely get tested when you return from travel. It's only if you have symptoms, and that would be the case now in Ontario because of the change in the testing recommendations. If you get tested on day 2 of coming back, well, you still have 12 more days. And just because you had a negative test on day 2 doesn't mean that in the next 12 days, you might not be incubating and could develop symptoms and become contagious. And so that's why, even if you have a negative test, you're required to complete those full 14 days.
Okay. And then a couple of questions from snowbirds. Jackie says, I'm a snowbird. Is there any word about seasonal trailer parks being allowed to stay open because she can't travel now?
I think that's something that I would ask the trailer park that you're looking at. This is certainly a big concern. Yes, people who, half the year do live outside of Ontario or outside of Canada, and how are they going to manage? And you actually really have to balance the risks of traveling to a southern destination, for example, and perhaps the higher risks of getting COVID, or what's your health care going to be like there. So I'm not sure of any guidelines per se related to this, but I do know that, Cottage Country is aware that some people who may just have a cottage there over the summer months may stay through the winter, for example. And so I would, if there's a particular trailer park that you're thinking about, inquire with them.
Okay. And then another question from a snowbird. Diana asks, why can one fly to the States but not drive? We are snowbirds and we want to drive to our winter home.
That's a good question, and I don't have the answer to that in terms of why you can't physically cross the border while driving. I think you could ask that question to Border Services. Sorry, I can't answer that.
Definitely. No, that's a federal question for sure, for sure. We try our luck and see what information we can gather, but that is definitely a federal question. Okay, so moving on then. Mita asks, in order to enter Canada, though, do you need to show a negative COVID test?
No, that is not a requirement to enter Canada. You certainly cannot travel if you have symptoms or if you're known to have COVID and be within your contagious period. But some countries are requiring a test for travel. Canada is not one of them.
Okay. And then now we're going to move on to a bunch of questions regarding Thanksgiving and mingling with family and that kind of things, because many people are concerned about that right now. So Jim asks, I'm a divorced dad and my kids' primary residence is their mom's, although we do have joint custody. Can I still see them, although they're from a different household technically?
Yeah, so I mean, we're giving you recommendations that you should stay within your household. And if your household includes your children, then you can have dinner with your household. I think what you have to think about is, what are the risks of your children? If your children were away at university and they're coming home, maybe that's not a great idea, because when they're away at university, if they're living in a house with other young individuals, that actually is a much higher risk. Mm-hmm. If connecting with your children, you have concerns about it, I would say take precautions. And I think having a gathering with your children outdoors, wearing a mask, keeping that distance as much as possible, or other ways to make that connection safer. But if you're trying to connect with people outside of your household, virtual is the way to go this Thanksgiving.
Okay. Let's see, we've got here. So Aino asks, if we are not to socialize with anyone outside our families, why are children allowed to be with 27 other non-family members in school? And this is that layers of protection that we've talked about before.
That's right. So in a classroom, the children are not interacting with one another the way you interact with the people who you live with. Mm-hmm. They're wearing masks. They're keeping a physical distance as much as possible. They're being screened every day they come to school. They're making sure that they have hand washing moments throughout the day. And so that's why the classroom setting is different from a household setting. And even for those who go to work and, maybe interacting with other people at work, again, you're doing it with that physical distance as well. And so that's that distinction there.
Right, absolutely. And we've got several questions similar to this one. So again, why is it still okay to go to a restaurant with another, bunch of unmasked diners, but not okay to have your parents over for dinner?
So Toronto recently passed a bylaw where the number that you can actually dine with is six or fewer. And this is to kind of get at your household, that you should go to the restaurant if you're going to dine with your household members only. You're not to go there to meet up with your friends, because when you're sitting around a table, you can't keep that physical distance.
Okay, so I think the question though is that there's other diners in that space, not just at your table. So
I see.
Yeah.
Yeah, so in order for the restaurant to be open, each table needs to be 6 feet or more apart. And so if you're sitting at a table with your household, and another table is 6 feet or more apart. And there should be no crowding, no mingling. When you go there, you cannot get up unless you're coming, going, or going to the bathroom. And so that's why it's safer. But again, we have choices to make. And I think the better choice now is to get takeout to support that local restaurant, to eat at home. If you really have to or want to go and eat out, to choose the outdoor dining option instead.
Absolutely. And then Michelle says she's a little bit confused about the gathering limits. The Ontario government website still shows that private gatherings are 10 maximum indoors, 25 outdoors. Yet we're told that we can't visit even a small number of close family members for Thanksgiving. So is no one allowed to gather outside of their household at this time? Because the only emphasis she's heard has been on close family not visiting, which she says would be nonsensical, because if up to 10 people are allowed to gather indoors, except in the case of family visits, she kind of wants that clarified.
Yeah, so it's a good question. So our Medical Officer of Health for Toronto, Dr. Davila, on Friday is making a very strong recommendation to everyone to have Thanksgiving with your household. And, if you have to go out, to do it in safer ways. Now, the provincial law under the Reopening Ontario Act, the law is that you can have up to 10 indoors in your house and up to 25 outdoors. But the regulation is such that if you have 10 people indoors, they all have to be physically distanced. And so it's not that you can automatically have 10, it's based on your space. But even though that may be allowed by the law, it's legal, the recommendation is that we, for the next few weeks, really try and tighten our circle, because we really want to get the number of infections down.
Right. I think it comes down to just because you can doesn't mean you should.
That's right. And I think we really have to recognize that we're in a real crucial moment here right now. At the beginning of September, we were having about 40 cases a day, and now it's 239 cases a day, and so we have to do more, and that's what we're asking everyone to do.
Absolutely. I don't know I know that we were prepared. We knew that a second wave was coming, but the spike has been so enormous so quickly that I think, again, just because you can doesn't mean you should. You just try and do the best you can and clamp down for a little bit again.
That's right. And to talk about the increase, I mean, I think thinking about it as our gas is on the gas is going, the pedal is down and the gas is going. And if we don't slow down, we really have to put the brakes on to get the cases to go down. And so putting the brakes on means these added measures.
Absolutely. And so Val has an interesting question then. I live alone, she says, and there's no one in my household. I was planning to have Thanksgiving with my cousin who also lives alone and no one in her household. Can we still do this, just the two of us?
Again, the recommendation is that you stay within your household. Now, we recognize for people who are single, it can be quite difficult. Now, if you are single and you have someone who comes as a caregiver or a support that you see regularly, we are certainly saying you do not need to stop that, recognizing that some people really do need those supports and have supports on an ongoing basis. I think, everyone has to make their own choices. I think having a virtual dinner is something that can be quite fun. We can try it, but that is the recommendation for now.
Okay. And then Jen is looking for some clarification about outdoor transmission. She says that doctors have said that the risk of virus transmission is much lower when outdoors. And she says, I fear this is being used as a reason for people to feel justified in gathering outdoors and not be careful with the protocols like distancing and masking. So is it really true that outdoor gatherings pose little risk even without proper distancing and masking, or should people be doing all of these protocols even with outdoor gatherings?
It's a good question, and you're absolutely right. Outdoor gatherings, while they are lower risk, they're not no risk.
Right.
And so when you're having an outdoor wedding or religious ceremony or whatever it is, the risks are still there. And so if you have 25 people and no one's maintaining a physical distance, no one's wearing a mask, and one person is contagious, many people are going to get sick. So The reason why outdoors is better is because there's better ventilation, probably our surfaces are not getting contaminated, and we have more room to keep a distance. And so I think what we need to recognize is if we're going to be outdoors, we need to keep that distance. And I actually think there are some circumstances now when we're outdoors that we should consider wearing a mask. When you can't consistently maintain that physical distance, well, then when we're outdoors, it's not as hot anymore. And I think we can tolerate a mask better. And given the number of cases that we have going on, I think that that's also a good idea.
Absolutely. And I think, again, the operative word is safer. It doesn't mean it's 100% safe. At this point, I don't think anything is 100% safe unless you're in a sterile environment.
Or if you were to have it virtually, that might be pretty safe. Yeah,
that's pretty safe. Right. Absolutely. Okay. So Mace has a slightly different question, but kind of related. What do we do when a business that does in-home services does not want to follow social distancing protocols from the resident in the home?
So there are, in the regulations, it's very clear that if you're providing service, you have to follow the rules. And so if someone is not following the regulation, first off, as someone who's receiving the service, I think you should note to them to say, I don't feel comfortable with you being in my home because you're not practicing in a safe way. And then you can consider, based on what law is involved, whether there is a complaint process in place to make a complaint.
Okay. Okay, we have a couple of questions coming in live right now. Ashley asks, what is going to happen with Halloween? Will it be canceled? Are there any suggestions of how to trick or treat for kids, things like that?
So we're actually working on guidance for Halloween. I think there's no question that you can still get dressed up. I mean, that's very low risk. What the rest of it is going to look like is going to depend on what's our case counts doing in the city. And so you can expect to get some more guidance from us next week on that.
Okay. And then another one coming in from Margaret right now. We just went over this, but maybe best to reiterate again. She asks, how is it lower risk to go to a restaurant but not meet with your family who is outside your household?
Yeah, so I don't, and the thing is, I'm not necessarily saying that it's lower risk to go to a restaurant. And this is why Toronto Public Health is trying to recommend that the province halt something like indoor dining because we have seen cases of COVID spread there. And so you're seeing this lag in kind of the legal side catching up with the recommendations, but the recommendation is there that we're asking people to avoid non-essential trips and visits. And if you choose to go to a restaurant, that's something that you really want to do, to choose the outdoor dining option, preferably.
Right. I think what's happening for a lot of people is that because things are still open and because dining is allowed and because of all of this is it's permitted, there's a little bit of mixed messaging happening that if it is allowed, then why aren't the recommendations for families different, things like that. And again, I think just because it's allowed doesn't mean it's necessarily a good idea.
Yeah, and it's very, very confusing. I completely understand that. And I think regardless of what we're doing, we have to think about the public health principles. And that's easy for me to say because that's my profession. But really, if you can't keep a physical distance, if there are people that you don't live with, if someone might be sick there, if you're not wearing masks, those are all higher risk scenarios. And we want to avoid that right now.
Absolutely. And I think ultimately, we've talked about this so many times, it is up to you to take responsibility for yourself, to take responsibility for the people around you. And the basic guidelines are masking, keep your distance, do outdoors as much as you can. So just if you can just follow those over and over as much as you can, regardless of what's open or closed, you're going to be safer.
That's right. Yeah.
Okay, let's move on to some more questions here. Sammy asks, can we go swimming indoors at a community center to get some exercise when the temperatures dip? And if so, can we use the change rooms?
So I actually just got a call with my colleagues in Parks, Forestry and Recreation for the City of Toronto, and they have very good protocols and guidelines for allowing certain fitness activities like swimming to carry on with lower risk. And so you'll see that something like a leisure swim or a lane swim or even swimming classes, the numbers are greatly reduced and there are a ton of public health precautions in place. And so wherever you plan to go swimming, I would make sure that they have measures in place in order to make sure that it's a safer thing to do.
Okay, perfect. And then slightly sciencey questions, more complicated than we're used to. But Paul asks, I have a question about the transmission rate, or the R naught. Cases have gone up, but so has testing. However, has the R naught changed?
Yes, it has actually. So it's about 1.2, I think, the last time I checked. It's actually available on our website, toronto.ca/COVID. And so it's updated daily on what's called our monitoring dashboard. But it has gone up, and that's why we're seeing the spread.
So that essentially means that one person who is infected can infect more than one person now.
That's right. And so anything above 1 means that you're going to have growth of cases. When you're at 1, you're kind of at a steady state. When you're at less than 1, then you're doing very well.
Okay. And so right now we're a little bit above 1, which is not great.
Yeah.
Right. Okay. And so Bacon Trees, I love this handle. Bacon Trees asks, why do the PCR/serology tests state that a positive result does not rule out bacterial infection or infection from other viruses, and that a negative result does not mean a person is not positive?
Okay, so the PCR test for COVID is what we call a molecular test. It looks at a piece of the gene of the virus that causes COVID, and tells you whether you have it or you don't have it. It does not test the other bacteria or even other viruses. The standard test only tests for that virus that causes COVID. And so that's why it can't tell you whether you have something else causing your symptoms. So that's the first part. And then the second part was on...
the second part asked that a negative result does not mean that a person is not positive.
So a negative result, we say, is as good as the day that you have it, but it doesn't necessarily mean that you're not going to get it. And so I think that's what that wording is trying to get at is, if 2 days from now your symptoms worsen, then you need to consider getting tested again. And especially if you were exposed to someone, because the test only looks at what the swab picks up and if virus is present there. And if the virus is not present, it will read it as negative. So that's what a negative means.
Right. Okay. So I think that's where the confusion is, where you're not positive, because you could be positive in a few days.
That's right. Yeah.
Right. Okay. And then this is interesting. Said asks, how do doctors differentiate between deaths caused by COVID-19 and by other diseases?
So if a death is counted in our stats, it's because that person had COVID. They met what we call the case definition for COVID. They had a lab confirmed causative case of COVID. And while they had COVID, they passed away. Then that's counted as a death of COVID. So that's how we count the death.
Okay. And that's irrespective of other conditions or anything. If they have COVID, it's counted as a COVID death.
That's right. And it recognizes that there may be other things that contributed to the death or even that caused the death, but they died with COVID. And so it's counted as a COVID death.
Okay. And now we're just moving on to some more like transmission questions. Patrick asks, can the virus spread through money, coins, and notes and things?
Well, again, coins and notes, it's about touching. So it's about if the surface is contaminated, it could potentially spread. There are probably other things that are on coins and money that could spread as well. And so I think that's why when you handle things like that, the important thing is that you wash your hands before, wash your hands after, and that you make sure that those dirty hands you don't touch your face with.
Absolutely. Rachel asks, this is about wipes and things. Are regular wipes or only antibacterial wipes an okay substitute when out and about, or should we use hand sanitizer instead?
So you'll have to see on the wipe, it's really, we say 60% or more of alcohol is what you need in order to kind of get rid of COVID. And so I think you have to see what ingredients are on the wipe. Some of the wipes actually don't have even alcohol in them, in which case to clean your hands, the wipes are not sufficient and you would have to use hand sanitizer. But the wipes are helpful because if your hands are soiled, so you use the wipes first, take off the dirt that's on your hand, and then use the sanitizer afterwards.
Okay, but 60% or more of alcohol, that's a good number to remember. Okay. And then Matthew asks, what are the number of COVID cases that have to happen essentially for a college to shut down for a deep cleaning?
So there's no magic number. I mean, we get this question also for schools. How many cases in a school would mean that the whole school would shut down? And it's actually very much dependent upon each individual circumstance. We actually do an investigation for each case. Even though we've halted case and contact follow-up in the community, we're continuing to do it in institutions like schools. And so it would depend on if we're noticing that you have two cases and one gave it to the other in the school setting, well, that could be enough to shut down the classroom. If we have multiple ones related to multiple classrooms, well, then we may shut down the school. And school I use loosely because a big university might not fully be shut down. The other point to mention is community spread, and the number of cases in the community can also influence whether schools in general stay open or closed.
Okay, and you just mentioned that we've halted contact tracing for community spread?
Yeah, so because of the rise in cases that we've seen at Toronto Public Health, that regular, we certainly do the investigation for everyone, find out where they could have, get that details and who they could have spread it to. And in this short term, while the caseloads are too high, we're asking people to follow up with their close contacts directly. And so we will give them a letter, whether it's a workplace or wherever it is, to follow up directly. Now, the hope is that if you get COVID, you didn't have close contact with anyone, so there's no one to follow up with. But that is currently our process for people who are getting it in the community. But the institutions, the long-term care homes, the shelters, schools are continuing our usual process.
Okay. And that's because the caseload has just jumped so high right now.
That's right. With 236 cases a day, every day, you can imagine in a week you have more than 1,000, and it's just not possible to keep up with that, even with the 700 contact tracers that we have, even with additional support from other places. That load is quite high.
Absolutely. And we'll just squeeze this one in because, actually, we've just hit 1 o'clock, but I'll try and squeeze this one in. Kathy asks, the US has had flu shots available since the beginning of September. Why are we so late to the table?
They're coming. We're in October, mid-October, actually this week. Doctors' offices are getting it shipped to them, and they can start vaccinating, especially those who have chronic health conditions, very soon.
Okay, wonderful. So we have hit the 1 o'clock mark. Thank you, doctor, so much for answering all of those questions once again. We still have quite a few left, but we'll carry those over for next week. Thank you for everyone. Thank you to everyone for joining us and for submitting your questions. Thanks, doctor.
Okay, bye-bye.
All righty, bye-bye.